I'm really excited about allergy drops because it's something that I am very passionate about, the type of medicine that I practice. And this is something that fuses all the different components of how I practice medicine and how I believe that patients be able to take control of their lives. So I'm delivering something that's very effective, that's been proven over 25 years of medical studies that's effective. And I'm seeing patients tell me how much relief they get. Allergy drops actually is a great synthesis of this conventional and alternative medical concept that we talked about, because it takes a conventional idea, which is immunotherapy for allergies, so taking extracts from allergens that we're exposed to, but delivering it in a really new and exciting way. So we take the same components that we use for allergy shots, but we put them into a form that can actually be used under the tongue. And so we're stimulating the immune system to counteract the effects of allergies so that we actually relieve suffering and relieve symptoms before they even start. Allergy drops are as effective, if not more effective, than allergy shots. And the main reason is because only about 35% of people who actually go to a doctor and get allergy shots ever complete it. And if you don't complete the whole series of shots, then you don't really get the full benefit and long-lasting immunity to allergies. Allergy drops have a much higher compliance rate. About 85% of people who start allergy drops will finish them. So more people are going to get benefit from allergy drops than from allergy shots. What makes allergy drops so exciting for me really is because allergy drops are actually very safe. If we do allergy shots, we have to go to a doctor, and because there is potential side effects, and some of them can be very serious, really you have to do it in a doctor's office, and it has to be supervised. And that means you have to go every week or every couple of weeks to do that. Allergy drops, because they're so safe, they can be done from home. What makes allergy drops so much safer is that with shots, the potential for severe reactions is caused because when the shots are delivered into the arm, there is an immune reaction that can happen, which can be very severe. So it can cause severe asthma attacks, it can cause closing of the throat, it can cause even death. But the cells that mediate that don't exist under the tongue. So when I deliver the allergy drops under the tongue, the potential for that doesn't really exist. So that's why they're so much safer, and they can be done from home. They can even be used for small children. And we use the same extracts that a regular allergist will use for their allergy shots, but we put them into a glycerin base, and we do them all in-house because each patient's different. So based on the unique makeup of every patient's allergy profile, we're going to make the drops specific to that patient. So we actually do it in-house, so we have complete control over exactly what goes in there, and we know exactly what each patient is getting, so it's specific to their allergy makeup. So the way we make the allergy drops is we take an extract from each of the different allergens. So let's say, for instance, someone has an allergy to cat. We're going to take an extract which is made from the dander, or the protein that causes the allergy problems, and there's companies that actually make those extracts. And we take each of the different extracts, so let's say that in this case it would be cat, and we can also put in their dog or ragweed if that is what the patient is allergic to. And we take a little bit of that extract and we put it into a glycerin base so we can go under the tongue. And each month we increase the concentration of the extract so that little by little the immune system is being exposed to more and more of the allergen. And as we do that, the immune system is making a greater and greater response to neutralize the allergy reaction. My patients are really excited about this treatment because many patients have suffered with allergies for many years. Seasonally, they'll have watery, itchy eyes, runny nose, sometimes even asthma. And this has actually been life-altering for many patients. I had one patient who every fall she could not wear her contacts, and it was very uncomfortable for her. After one season of getting allergy drops, she doesn't have any problem at all, and even her eye doctor was very impressed by the results and doesn't see any problems with her eyes every allergy season. The main reason why I started doing the allergy drops in the first place is I'm a trained allergist, and I was using conventional allergy protocols for years. When I was introduced to the allergy drop concept, I was very excited about it because this is a way that I can actually take a conventional idea that's more usable and more convenient for a lot of people. And that's very exciting to me because it fits in very well with my whole concept of how we should be delivering medicine and how we should be empowering our patients to take control of their own health and wellness. So the allergy concept is really perfect because it fits into my training, it fits into what I'm passionate about, is what's really empowering patients to take more control of their lives and their health. And it also allows me to treat the underlying cause of a problem instead of just treating the symptoms.